Hey guys, this is Dr. John Mark Chesney with Simply Physio, and I'm bringing to you today a mini-series on the 5 most asked questions to a physical therapist. And number one question asked to a physical therapist is, don't I need an MRI to know what's going on or what's wrong? Or stated, shouldn't I get an MRI before coming in to see a physical therapist? So this is a great question, and what we have to really understand is what is at the root of this question. And what is going on in an individual's mind is, first of all, they're in pain, and second of all, what's scarier than being in pain is not knowing why you're having pain and what's causing it. And so this can drive somebody to really feel like they need to know what's causing it, and thus they need to get an MRI, right? Well, let's take a second and really discuss what is an MRI and what is it good at, and where's its limitations. So the thing about the MRI, it is really good at doing what it's intended to do, and that is it will find every little defect and abnormality. It's typically considered the gold standard when looking at tissue and determining faults or issues. So isn't this a good thing, right? Well, we have to look at some other evidence and some other research of understanding as far as what do abnormalities, what do they actually show us and what do they actually tell us. So I want to talk about a study where they looked at individuals who were asymptomatic, meaning they don't have any spinal pain. And they took these individuals, these normal, healthy individuals, and they put them through an MRI. And what they found was for people in their 20s, they found that 37% of individuals had evidence of degenerative disc disease. When you go up to your 30s, 52% of individuals have degenerative disc disease. Your 40s, it goes up to 68%. And by the time you're in your 60s, 88% of individuals have degenerative disc disease, and these individuals, again, are normal, healthy, with no history, no back pain. So the other thing they looked at was evidences of a bulging disc, and everybody knows that a bulging disc is horrible and something that no one wants. But what they found was individuals in their 20s. With again, normal individuals, 30% of them had a bulging disc. In their 30s, 40% had a bulging disc, and once you get into your 40s, it goes up to 50%, and by the time you're in your 60s, 77% of individuals showed evidences of a bulging disc. So what we have to consider is what they determined was that these evidences of abnormalities are just normal signs of aging. In the same way that individuals start getting gray hairs when they get older, or wrinkles on the outside, you can consider these changes wrinkles or gray hairs on the inside. They don't necessarily tell you that something's wrong or that something needs to be surgically fixed. And what I find is when individuals have been labeled as broke or fragile by these MRIs, that their beliefs about themselves, it changes their behaviors. And when their behaviors change, they start acting like they're fragile, and they start moving more stiff, and they start cutting back and self-limiting themselves. And because of this self kind of restricted lifestyle and behavior, they start becoming more stiff and weak, and it just creates an environment where back pain can continue to worsen because of these change in behaviors. Another study actually looked at the cost of having an MRI, and what they actually found is if somebody has an MRI before getting physical therapy, that their cost of care actually increases by $4,793 just because they had an MRI before physical therapy. And a third study, what they looked at was the percentage of MRI machines in a certain area, and what they found was that the greater the higher volume of MRI machines in a certain area had a correlation with higher amounts of back surgery. So if you're in an area where there's a lot of MRI machines, you're at a greater risk, a percentage of getting a back surgery just because there's a lot of MRI machines, that people are getting MRIs more frequently. And they also found that just because there's a higher surgical rate, that it actually did not improve people's outcomes. So things that we need to consider: when is it a good time to get an MRI? Are there good times? What should go into deciding that? And so there's four main reasons that I want to just make sure people understand of when you really do need to get an MRI sooner rather than later. The first is if you have had significant trauma or injury. And symptoms that that are severe related to this injury or trauma. There's likely a good chance that an MRI is justified. The second is if you're having progressive muscle weakness. The third is if you're having any bowel or bladder changes. And the fourth is pain that is unrelenting and specifically worse at night. Now, you may be asking yourself, out of these four, like, maybe there's one that's questionable, you're not quite sure. Well, what I'd encourage you is to come see a physical therapist, because we can tell you very quickly if you need to go get an MRI or if you need to hold back and wait. And here at Simply Physio, we offer a free discovery visit. And so it's an opportunity that if you have some of these questions and want to come in for a 20-minute discovery visit, we can sit down and chat, and I can tell you confidently if you need to get an MRI first or if you're a candidate for a conservative treatment. And another thing to remember is if your physician is telling you to hold off on getting an MRI, it's probably because they're actually very knowledgeable and that they understand that if you get an MRI first, that you're putting yourself at greater risk for having to have surgery, and you're actually increasing your financial payout for your episode of care. So I hope this information is helpful to you, and feel free to reach out to me if you have any questions concerning the topic of MRI and back pain. Thank you for listening.